How do you diagnose uncovertebral joint degeneration? Well, the best way to see uncovertebral joint degeneration is on CT. We'll start by looking at the normal appearance of the uncovertebral joint, and then we'll look at the actual degenerative changes. If we look at the image right-hand side of the patient's left, this is the uncovertebral joint, and coronal CT is the best plane that I find to actually look for uncovertebral degeneration. This is the Uncinate process, and that articulates with the infralateral aspect of the vertebral body above. Now, there are a number of names for this region, but generally it's just considered the articular margin of the uncovertebral joint. So this inferior margin of the vertebral body has got a beveled or angled appearance, and the uncinate process from the vertebral body below articulates with that. There's a bit of debate as to whether this is a true joint or not, but I think now it is considered a proper joint, and there is some fibrocartilage in here. It is a synovial joint, so it's prone to inflammatory change as well. The main purpose of this joint is to restrict lateral flexion of the neck. If we look at the anatomy of this joint, and this image is from this article here, which is a nice article going over the anatomy of lateral view of the uncovertebral joint. So here's the uncinate process. This is the articular margin at the inferior portion of the vertebral body. So this is where the uncinate process articulates. And the importance of this is that you can see that this joint forms the anterior margin of the intervertebral foramen. When you get osteophytes arising from degeneration from this joint, they will extend into the foramen and can potentially compress the exiting nerve root. Let's go back to the CT image now. We can see that the uncinate process is here. Here's that inferior articular margin. Nice space between the two. It's well preserved. There's no degeneration here. But if we come to the contralateral side, we see a combination of narrowing of that joint space, significant sclerosis at either side of that articular margin, and the whole region is hypertrophy. You can see that there's hypertrophic change at the uncinate process compared to the other side. We don't have the lateral on this view, but if we saw the lateral, is likely to be osteophytes arising from here and extending into the intervertebral foramen. So the importance of seeing the degeneration here is twofold. One is that there can be osteophytes extending from that degeneration into the foramen with nerve root compression. Secondly, this can be a pain generator on its own because there's significant degeneration here at that joint space. So uncovertebral joint degeneration best seen on CT, and predominantly start by looking at the coronal reformats to see the degeneration, and then look at the sagittal reformats to see whether there's any foraminal narrowing from osteophyte formation.